Good morning, everyone, and welcome to our weekly live question and answer, Ask Us Anything, where I sit with one of our physicians. Usually that's Dr. Ellithorpe, our medical director and founder. I want to thank you for joining us today, and we want to make this an interactive event, so ask your questions here. I see some questions are already coming in on the live chat off to the side of your screen here. You want to make sure that you are logged into YouTube so that you can participate in that live chat. And if you cannot, you can send us questions anytime during the week. Email those questions to us at office@tlcdoctors.com. That's office@tlcdoctors.com. And just make sure to put in the subject line, question for YouTube, live Q&A, something like that, and it'll get forwarded to us, and we'll be sure to ask those questions on a following episode. One last thing is I just want to make sure that everyone understands that this is not intended to replace your relationship with your physician, nor is this meant to be medical advice to you. This is for education and information purposes. And when I ask the doctor your questions, she's answering them as if she was sitting with a patient in the office, how we might approach this. Of course, when you're sitting with your doctor, they know your full history and background and medications and can get into more specifics with you. Dr. Ellithorpe, how are you doing today?
I'm doing well. On Monday night, it looked on the computer when I was operating it alone like I was not getting any more of the questions. Mm-hmm. And so I ended it, but I had to because I had that lecture to do. Right. And then I came back to it and I saw there were many more questions. So I'm going to take a screenshot of that and get to those questions next Monday.
Right. I know sometimes with YouTube, especially when we're streaming live, we have technical difficulties. The traffic gets jammed up. Sometimes there's audio problems or whatnot. So we apologize for any issues with that. Please let us know in the comment section if you are experiencing any difficulties.
Yeah, I asked, can you hear me or anything, mm-hmm. and none of the responses came through. So I just assumed no more questions. But then I saw them, so I'll be sure to get to those questions on Monday night.
Okay, wonderful. I have some questions that were emailed into us. Should we start with those?
Okay.
Okay, Dina emailed a question and she asked, can you talk about NAS? What is it? Is it something we should supplement? Is there something similar you recommend through TLC? NAS.
I think she meant to say NAC. Yeah,
okay.
N-acetylcysteine. N-acetylcysteine is an antioxidant. It's a precursor for glutathione. It's a powerful reducer of glutathione, which is needed in every cell, in every mitochondria, and you have hundreds of them in each cell. Mitochondria are what make the energy in your body. Now, there is some in your TLC energy core, mm-hmm. and so that's there. We do have it separate, and it's from a high quality company, Orthomolecular, and it is a smart thing. It's been found useful in helping to produce mucin and detoxing elements in your liver. So when you have trouble with congestion and mucus production, it's a very valuable thing. Do you need to take it supplementally? Not necessarily.
Okay. So NAC, Dina, if that is what you're referring to, N-acetylcysteine, a very valuable supplement, and it is found in many of the things that we prescribe here. If NAS is what you meant, I'm not familiar with that, but please spell that out for us and we'll make sure that we answer that. Okay, we've got a question that was emailed in from Patricia, and she says, hello and thank you for all you do. I would love to hear more about the recent study or studies on natural immunity. Is there a link Dr. E could point to for this? Also, can she speak to the idea of quiescent cells resting in your bone marrow after having had the COVID virus?
Well, the most famous study was the one that was recently done a month and a half ago now in Israel. And they have excellent data, and if you type in on the Google search natural immunity Israel, it'll come up. Okay. You'll see it there. It's so famous at this point in time now, and it made very clear that there was even as much as a 27 times greater immune response, natural antibody response to those that previously had caught the viral SARS-CoV-2, whether or not they had the symptoms or the disease COVID-19. But it was well established that the experience of exposure to COVID-2 produced tremendous natural immunity. It was found in the study, and we're talking, there were millions of people in Israel. It's a well-controlled environment. I don't recall the exact numbers now. I've read so many articles, but we're talking a large N number of people studied. So this is not questionable as far as the power of the study. It's quite powerful. And they pointed out that the immune response is durable and long-lasting.
Okay.
So that's quite supportive. Now, as to do you always maintain antibodies in your system? And the answer is no. Your antibodies will diminish, but what then goes on is your memory cells, T cells, there's helper cells, T1 cells, T2 cells. These cells pick up the memory of that event, so that if you have a second exposure, it's well capable within minutes, hours, to start building up another antibody response and defense of your body. And yes, those cells are not only in your bone marrow, they are circulating, they are in your lymph nodes. And so we have been made by God with a powerful, powerful network of self-defense in our immune system. So that's not the only study from Israel. There are several studies now about the antibody natural immunity, its durability, and its long-lasting stance.
Okay. We have a question from Margot, and Margot asks, does TLC offer monoclonal antibody treatments to walk-ins above age 65 who qualify under the government's protocol? I will be your patient later this month. I'm asking for myself and my sister. Thank you.
We're working on that as we speak. We don't have it at this moment, but we're looking to see if we can make this available in our IV suite. And I wouldn't know how close we are to that event. You would have a better idea.
Yeah, we're right there. I know the doctors have been discussing it. I think the what we're looking into is many of the IVs we do, including our immune drip, is very effective, and we've seen great lasting relief from our patients that have thought that they had a virus or were infected, just quick recovery. So we were just weighing the benefits with the monoclonal studies and looking at those versus what we've already been doing all through COVID this whole time.
Right. All our patients have done very well. We have had no mortality. We've had no hospitalizations to my knowledge, and we have a wide swath of patients. We have thousands, and they all did well. And it is well established even in China after the SARS-CoV-2 virus broke out. There are studies there showing that high-dose intravenous vitamin C was associated with preventing death and reducing hospital stay and morbidity. So yes, we've done well with what we have, whether or not you have that monoclonal antibody. So we were ready for this. We've been preventative medicine all along, and it is just so comforting to know that everything we've done for our patients over the decades, and we've been here for decades, has proven to be just and valid.
Yes. Okay, one more email question, then I'm going to get to the live chat. Duncan emailed us and said, hey, I was wondering if Argentin 23 is safe for newborns and infants. Also, what would you recommend for sick babies to take, or the nursing mother for sickness, basic colds? My wife already takes Juice Plus. Thank you.
Yes, I agree. You can use Argentin Silver on the newborns and the breastfeeding mothers. It's quite safe. In fact, you have to know that they use silver in the eyes of newborns for many decades as a standard practice in prevention of disease transmission through the birth canal.
Right, especially if the mother's known to have some kind of venereal disease, they'll drop those in the newborn's eyes.
Right, so yes, it's quite safe to do.
And I can speak from experience because our little newborn has been getting the Argentin 23. For those of you who don't know, that is the hydrosol silver, similar but not to be confused with colloidal silver.
Right.
And we've sprayed that all over him, put it on his little cuts, his bruises, and his mouth. He loves it when I just take out the bottle and he opens his mouth and we spray it in there and he giggles.
Yeah, that's cute.
Okay, let's get to the live chat and see what we have there. All right. Ophelia says, you are out of stock on NAC. When will you have a supply available? If not, what reputable company can I order from? Well, I did hear that. I'm not sure I have an up-to-date answer because I didn't check with them today, but we should have that back in stock any day. We are already on Orthomolecular's back order. I know that we have things that have very high doses of NAC, as Dr. Elthorpe mentioned earlier, Ophelia. You can get the TLC Energy Core, and that's going to give you a very good dose of NAC already in it. If you're already taking NAC, then I'm sorry, if you're already taking Energy Core, you are getting NAC. Also, our immunity. The Immune Protect. Our Immune Protect has a very high dose of N-acetylcysteine in it as well. Orthomolecular did let us know a couple months ago that there were some stirrings around with the FDA. I would say rumors that the FDA may look to make N-acetylcysteine a drug or go down the new drug type thing. So I don't think that progressed, but I think just the rumor of that scared a lot of the raw material companies and companies that manufacture N-acetylcysteine supplements, so people were buying this stuff up. So we did our best to stock up, and as far as I know, just the NAC by itself from Orthomolecular we were shortly out of, but I think we'll have that in any moment, Ophelia. So hopefully that gives you some options there. Debbie says, do you think any fruits are valuable to keep in our diets, as I know you're not a fan of any sugar? Thank you. Well, I would just say, remember, any food becomes bad food when we eat too much food. Fruits are wonderful. They're natural. It's just that our diets and our lifestyle in America especially abuses sugar so much that any additional sugar, especially fructose, can tip us over the scale. What say you?
Well, if you're going to ask what is the safest, healthiest net power of fruits, it would be the berries. It would be blueberries, raspberries, blackberries, and strawberries. So the net antioxidant micronutrient value exceeds the amount of fructose that's in them. So when I do say you can have fruit, that's what I'm asking for. Now, again, you have to limit it, to a serving a day of maybe a cup's worth. But and then I often tell people to who want to put something on it, I'll say use heavy whipping cream, put a teaspoon of that on there, and it makes
that's a nice treat.
A decent treat if you can handle dairy.
Right. And it's going to depend on the patient and their labs. If how's their fructosamine? How is their triglycerides? How is their glucose?
Right.
If you're a healthy individual and you're limiting your sugar and your carb intake, and you're exercising regularly, you're leading an active lifestyle, then sure, you can get away with eating more fruits. And fruits are wonderful. They have tons of micronutrients in them, but that is why we lean heavily into, with most of our patients, Juice Plus, which removes the sugar and maintains those micronutrients in the capsules. Right. Okay. Amela says, is it possible to a lot of NAC questions today. Is it possible to react to N-acetylcysteine? I felt lightheaded and my eyes were itchy when I took it.
I've never heard that.
I haven't either.
I've never heard of a reaction to N-acetylcysteine. So,
I mean, it's in your body, right? We all have it. We need it. It's a precursor to glutathione.
Right. So I would say, be cautious. Come see your doctor or me if I'm your doctor, and we'll look at this. But no, I've never heard of that kind of reaction. Of course, this is the fall. And the fall is associated with allergies and so forth.
Right now.
So
and NAC is wonderful to take preventatively for allergies and immune reactions.
Exactly. So that's something that has to be handled more specifically with a doctor's visit to address that issue. I've never heard of it.
Okay. Next question. A doctor thought I had COVID back in the beginning of 2020. At a CVS clinic, I had an antibody POC, IgG, and IgM test, but the results were negative. Is there another type of antibody test?
Well, we do antibodies are antibodies, so there's not another type.
There might be a serum, like a blood test versus a nasal swab antibody test.
But they're measuring the same antibodies.
Same thing.
So
antibodies are antibodies.
Right, antibodies are antibodies. So if you get it retested, you might find that you have a response at this time. So I order the SARS-CoV-2 semi-quantitative antibodies IgG and IgM. That's how I order it.
Okay. Susie says, does the Pfizer Moderna MSDS material safety data sheet show what the vaccine does and does not do, such as how long the shot lasts if it produces? Well,
number one, the vaccine inserts, to my knowledge at this point in time, are blank. And the statement on the inserts in the vaccine thing, like any other prescription, it is a thin paper like tissue, and it says left blank intentionally. So we doctors don't have the information we need to make an informed consent. So we can't tell you that. I have seen the FDA response where they said they gave approval to Comirnaty, which is not available yet, but they gave extending to the EUA emergency use authorization for the current Pfizer vaccine. But in doing so, they were to have, within 2 weeks of that letter, August 23rd of 2021, they were to have given an ingredients list. That ingredients list, my understanding, was produced. I saw a video on this, and 22.5% of the ingredients on that ingredient list demanded by the FDA was redacted. So how can I give informed consent when there is so much still left unexplained? So there you have it.
Okay. Deborah says, if you have had COVID, are there any laws on the books, or is it medically necessary to take the COVID vaccine that are mandated by our employer?
Well, a mandate is not a law. There is no federal emergency order from the president. There is no law requiring this. Zero. There are multitudes of laws over many decades that protect your right as an individual to say no to experimental treatments, to say no if there's not clear, informed consent. So mandates are not laws, and that's just the fact.
Mm-hmm. And states are coming different. Each state is handling this differently, and some states are coming out with their mandates, and these will be challenged, I'm sure, in court, and we'll just have to wait and see.
Right. I know, for instance, yesterday in Texas, Governor Abbott said there will be no mandates by any entity for vaccination in the state of Texas.
I think Florida is similar too.
Yeah, I think Newsom has given a mandate, but that's not a law. So the laws that are superior are the ones that identify, like in the Nuremberg trials, and treaty law supersedes everything, in which the international law of international criminal courts protect your autonomy to your person for experimentation and requiring informed consent. So there are many such laws that you should not look at a mandate as a law, nor should your employer. They have no right to do that. They're going to be facing probable court challenges. I know of 9 court challenges that have already been done, Now, there was one in Portugal, there's one most recently in Spain, there was one in Alberta, Canada, and 6 others I can't recall off the top of my head where at, but they all won their cases in court based on these laws I'm referring to and the fact that they can't establish the emergency at hand and so forth.
What are the benefits of ginkgo biloba?
Ginkgo biloba is an antioxidant. It is associated a lot with memory enhancement. That's probably what it's most famous for, but it does have cardiovascular benefits, which actually bleed over, you might say, into the brain circulation. So ginkgo biloba as an antioxidant is quite well known for its mental enhancement.
Okay. How much vitamin C, D, and zinc should we take daily?
Well, it depends on your weight. An overweight person needs more D than others because it's fat soluble, so you need a larger quantity to overcome the excess fat you're carrying. In general, they have finally recommended doses of vitamin D to the 4,000 international unit per day. I take 10,000 and sometimes I take 15,000. We have very safe data on this. I've been using this for decades and decades. We even have some patients at 20,000 a day, but I have never seen any harm from 5,000, 10,000 ever. We like to marry it up with vitamin K2. Okay, so vitamin D 10,000 with K2. Once a day, every day. Vitamin C, that's more variable. That's a water-soluble vitamin, and it's to bowel tolerance because you can take enough vitamin C that it'll make you have diarrhea, so we don't want you to do that. So you have to kind of experiment with C yourself. But the general recommendation is 1,000 milligrams a day. The daily requirement is 60 milligrams a day, which is almost just enough to avoid the disease scurvy. So I think if you took 1,000 milligrams of C a day, maybe up to 4,000. And then zinc, if the adequate amount is around 5 milligrams a day, and that's what I have had all my patients on for years in our multivitamins. But if you're acutely starting and you haven't been knowingly supplementing with zinc, I would say, 25, 40 milligrams daily and do that maybe for a month. And then you should be able to back down to, 5, 10, 15 milligrams a day.
What can I do to help my teenage daughter regulate her menstrual cycle? She has a period every 2 weeks.
Well, she is not ovulating because ovulation is dependent upon stress. With more stress, the cortisol will suppress the follicle-stimulating and luteinizing hormone communication. Therefore, she's in a discordant buildup of the lining of her uterus. It's just building up because estrogen is not suppressed with stress. Only progesterone ovulation. Therefore, if you want to get a nice clean out of the uterus, you have to get supplemental natural progesterone and use it cyclically 2 weeks after the start of a menstrual period. Use it for 10 days. We have over-the-counter Kokoro balanced progesterone cream, which is quite safe. You can use several pumps, and just rub it on your skin and do that from day 15 to 25 of the cycle, and she'll come around.
But if her cycle is every 2 weeks, she's not going to make it to that day 14, day 15.
Well, she'll just start applying it even in the presence of the menstrual cycle, but eventually it will come around, okay? So if she just declares, today on the 15th of October, I know it's the 13th, but let's say she started progesterone on the 15th, and she used that for 10 days to the 25th, then the next cycle she would use next month, the 15th of November to the 25th. That's how I would approach that case in my situation. Okay. And then we would do a blood sample in the 3rd month while she's on the progesterone, and you'll see that the cycles will come around.
Okay.
They always do.
Let's see. It looks like I skipped a question about immune support from Jennifer. Or did I miss something from Jennifer? I did. Oh, Jennifer says, sorry about that. Thank you for creating immune support. I want to recommend it to friends and family. Can they walk in and buy it at the supplement suite without being a patient at TLC? Yes, the TLC Immune Protect, I think that's what you're talking about.
Yeah.
That you can walk in and get over the counter. I will say that currently our website, you won't be able to, I mean, you could purchase it for them, but you have to be a patient to purchase things online, but you can walk in and pick it up. They can walk in and pick it up, and that is because we have to control what we're shipping out to people that we don't know versus walking into the clinic. Okay, Jennifer, I hope that helps. Carol says, thank you so much for the valuable information. Love hearing the truth from such a knowledgeable person.
Thank you.
Thank you. Got one here from, looks like Dolphin. What is the dose of ivermectin for someone who presents with COVID injuries?
You mean a post-COVID, they had it and now they're having the long COVID, long haul syndrome?
Yeah.
Okay. So I would still have them use ivermectin based on their weight. Mm-hmm. So the dose will vary, but the range typically is roughly 12 milligrams to 18 to 22 milligrams. And we would continue that out for a couple of months. Mm-hmm. I would encourage chelation therapy as well as the systemic enzymes, a low-carb diet, plenty of water, and walking, some aerobic cycled kind of exercise.
Right. And you can bring this information to your doctors if you're not located and you're not under our care. I believe it's FLCCC.net. That is information that is based on many doctors' experience, many studies done with ivermectin that will help you break down the weight and the dosing, and then preventative versus
the long haul.
Or long haul.
So there's preventative, there's actual treatment when you're having the illness acutely, and then there's long haul syndrome should you need it.
Right. So just Google FLCCC ivermectin. It'll come up, or I believe the website, if you go directly, there's FLCCC.net or
Yeah, and another way they say it is iMask.
iMask,
Yeah.
the iMask protocol. The letter I, mask. Okay. All right, it looks like we got through.
Yeah, I'm going to have to get
Oh,
to
right,
the
and
patients.
Dr. You're not keeping track of time. We're at 10:14. Okay,
All right.
everyone. Well, we're going to wrap up today. Wednesday mornings are about a half an hour with us for live questions and answers. Dr. Ellithorpe is here on Mondays as well, too. And your regular time we're going back to next week.
6 o'clock.
At 6 o'clock p.m. You can tune in here, and Dr. Ellithorpe tends to go over a half an hour. It is just her, you, and the camera. So feel free to show up and tell your friends and family to join us Monday at 6 p.m. Pacific time. Bring your questions, have them ready, and the doctor will start answering those right away. Do us a favor, if you enjoyed today's presentation and the question and answer format, hit that like button, and even better, subscribe to the channel. That'll help us get the word out there and spread the good news. Invite your friends and family to join too. You do not have to be a patient to interact with us here and ask your questions. Ask us anything health related. Thank you everyone so much. We look forward to seeing you Monday evening at 6 o'clock p.m. Bye.
God bless.